Good morning and welcome to ICUS Bubble TV. I'm Linda Feinstein, and today I have the pleasure of speaking with Dr. Yuko1, one of the foremost experts of contrast-enhanced ultrasound. And we're so happy to welcome you here today and have a conversation with you about contrast-enhanced ultrasound.
Thank you so much, Linda. Thank you. Good morning, everybody. My name is Yuko1. I'm a hepatologist at UC San Diego, and I practice contrast ultrasound for more than 20 years.
That's remarkable. Tell us why do you practice and why do you use contrast-enhanced ultrasound?
So as a hepatologist, actually, I'm from Japan, and I was trained as a hepatologist there. And we, all the hepatologists do ultrasound ourselves. Not like here, we do have sonographers, but we do ultrasound ourselves because it's very important for those people with cirrhosis, hepatitis B, who are at risk of developing liver cancer or HCC. They need to have ultrasound every 6 months for HCC screening. And I met with Bubbles, I met with contrast ultrasound in an early practice in 90s, and I was very excited. And then since then, we've been using it for the liver lesion diagnosis and many other applications.
Tell us how it works.
So, contrast, these are tiny, tiny micro bubbles that get a little vibrated in the ultrasound fields, and it creates a very special signal, and ultrasound detects those signals and create a nice pictures with the blood flow informations. And with the technology development, we now have a beautiful, beautiful real-time imaging that's much more sensitive and in some ways better than CT or MRI.
Tell us examples, please, of where you would find a better image or more information as a result of a contrast ultrasound exam.
So the strongest, the advantage is real-time imaging, because CT MRI, it's also getting better, and I love MRI as well, but it's kind of still pictures once in several seconds, or even CT slower, while ultrasound we have real-time imaging. Like, although we use a little slower imaging than usual ultrasound, still, 10, 15 frames per second. So we would never miss this arterial phase. It's called, basically when we inject the contrast, whether CT, MRI, or ultrasound, the bubble, not bubble, contrast just comes first in the arterial system. In the liver, it's very crucial to detect this because liver has two blood supplies, hepatic artery and portal vein. Tumors, especially, and like HCCs, they have a lot of arterial flow. So the artery, when contrast comes to artery, it lights up and it enhances. And CT often misses, not often, sometimes, radiologists will be mad at me, sometimes misses the arterial phase, and they are like, oh, this arterial phase was too early, too late, I can't see the enhancement. We would never ever miss this arterial phase, and that's number one. And also, because it's real time, for example, like benign liver tumors like focal nodular hyperplasia or adenoma, these have a very specific enhancement pattern in arterial phase, whether the vessel comes from inside to outside or outside to inside, which only CUS can show because we are real time, while MRI and CT can show only enhancement. So these are I think the strongest. And then of course, it's safety issues. It's very safe for, patient with kidney disease or anything. And that's why, pediatricians love it. It's a very, very nice tool.
That's excellent. Can you tell us a little bit about LIRADS? I know that you are a leader on the development of LIRADS for contrast-enhanced ultrasound, and I'd love to have you talk about that for us.
Thank you for asking. So LIRADS, it's amazing. So it's a show for liver imaging, reporting, and data system. And it was initially developed for CT and MRI diagnosis of HCC for those at risk for liver cancer. And HCC is a very special cancer where we use imaging for diagnosis in more than 95% of the time without biopsy. If imaging is typical on those at-risk patients, then we can diagnose HCC without sticking a needle. But because of that, the imaging has to be so accurate. We cannot make a mistake. If we call LIRAS 5, which is 100% liver cancer, we will send the patient to surgery, transplant, other treatment without tissue diagnosis. So we cannot make a mistake. So we started developing this LIRAS system so that we can diagnose, number one, HCC very accurately, and then number two, then other patients, not the definite HCC, but liver nodules. What are they? Are they benign? Are they, malignant, or more likely HCC? Or we don't know. There was no system to tell you that before. People knew how to diagnose HCC, but then other lesions just do biopsies. So the LIRAS nicely, show different degree of HCC probability and malignancy potential, and we have a treatment recommendation or follow-up recommendation depending on the probability. Now, CUS came in later, and I was asked to develop this system, and I had many really nice colleagues work with me, with us. It was very nice to develop the CUS LIRAS system, and now it's official. We are still struggling in this country to get recognized by the Liver Society, so we are working on that.
Good luck with that. I think that's so important for the patients. And thank you so much, Dr. Kono, for spending some time with us this morning and telling us about your work with contrast-enhanced ultrasound and LIRADS, and for all that you've done for the field.
Thank you so much.
Thank you.
Thank you.